Hi there, everyone. This is Tony, co-owner of Coastal Chiromed, and I have Dr. Garrison with me. And today we're going to show you the various ways. Got a phone call coming in there. Dr. Garrison, why don't you take it away?
All right. We get a lot of patients who may be scared or nervous about chiropractic care. They've heard that we crack bones and such like that. So we really wanted to demonstrate how many different techniques there are to adjust your spine and how gentle it can be. And we typically try to fit the adjustment to the patient. So there's a lot of patients with different conditions. We treat infants, we treat elderly men and women who have osteoporosis.
You mean elderly like me?
But we have to treat the patients based on their body type. So we definitely change that and make it as gentle and effective as possible for each patient. So we wanted to demonstrate that for you today so that you could take out the scariness. It's Halloween, right? Take the scary factor out of being adjusted by a chiropractor.
No, it's my birthday. That's the scary factor.
So happy birthday to our co-owner. He's going to go ahead and lay down, and he might want to share some of his pain issues or conditions with you.
Well, I've always had a low back pain because I'm tall, and when I worked on the farm and I did a lot of athletics when I was younger, one of my discs are very, very, very small, so I need a regular adjustment to keep that supple and keep it wide apart so that the nerves don't get pressured. And if I miss adjustments, or if I don't exercise, because I'm always exercising my low back, I'll get pain. But today I feel pretty good because I've been adjusted regular.
Yeah, and he gets checked anyway, so we check and see if there's anything going on in his spine to make sure that those nerves are functioning properly, because those nerves go to your organs. So sometimes people will have constipation or IBS or some kind of bladder or reproductive organ issue. All the nerves in the low back also go to those internal organs. So I'm checking his legs here because there's muscular compensations for misalignments in your pelvis and your low back. And he does indicate that there's something misaligned. So we're using a drop technique where the table helps do the adjustment. It's very gentle. We put just a minimal amount of pressure, right into his pelvis, and that helps change the alignment issues. We definitely can be very gentle. Another thing that we can check is for rotation. So we do a leg check this way, where I'm gonna have Tony lift his leg for me. And then he's gonna lift the other side, and you could tell that one went up a lot easier. So there's an adjustment that we do where we just open up the joint space by having him cross his leg. We do a little gentle adjustment just like this, and it's very gentle. And then we recheck the legs to check for that correction, and he can tell that there's a change there in how easy he could lift his leg. So we definitely have gentle treatments here at Coastal Chiromed. There's a lot of other instrumentation type of adjustments we can do if there's some health issue or even just the patient's preference. There's an activator. It sounds like a stapler, but it's very gentle and it can focus the adjustment in a certain location. It is fine to use for children. We also have some other devices where can be a controlled adjustment. Some people don't like the drops. Some people don't like the sound of something popping. You've probably heard people say that, we crack bones. We actually do not crack bones. What we're doing are opening the joint spaces up and realigning the bones. Sometimes there's gas in the joint space, and that will make a popping sound. Sometimes the joints don't pop if there's no gas in there. So that's sort of a layman explanation of what's happening when we do an adjustment. Tony does get adjusted and takes care of his spine regularly, as do I, regardless of pain. So yes, pain definitely can be helped with chiropractic care, but we have experienced how much it improves our function, from numbness and tingling to all of our other functions can improve with chiropractic care.
Yes, so here you have it. Come and say hi, like our page, and share the video. We also have a YouTube channel. It's called Pain Free with Dr. T. I'm talking about Dr. Suzanne. She still has supervisory executive powers here, so we've been putting all those videos in her channel. So check them all out. So anyways, we're signing off. See y'all later, and God bless.